good morning and welcome to our physical examination videos under International Medical University. I'm Associate Professor Dr. Sanjiv. So today we'll be going through a normal physical examination for the hip examination. We will use the four-step technique, that is feel, look, feel, move, special test. So today we have our patient over here and we'll go on with the physical examination. A very good morning. I'm Dr. Sanjiv. I will be examining your hip today. Thank you for letting us examine your hip. Are you okay for us to examine your hip? Sure. And during our physical examination, you'll be able to expose the area of interest. Is that okay? All right. Just 1 second. So always sanitize your hands before you examine the patient. So you greet the patient as normally. Sir, can you stand please for me? Thank you. Can you stand here? So as we can notice, the patient has stood up from a sitting position with ease, without pain or without leaning towards one side. It's a good sign that he doesn't have a hip pathology on one side. So sir, can you please walk for us? So as you can see, the patient has a normal gait which has a normal stance and swing face. We would like to rule out Altalji gait or Nuremberg gait or high base gait, wide base gait. So now we will start our physical examination and look stage, where the patient demonstrates normal muscle bulk. There's no wasting. There's no appearance of a scar, a surgical scar, that usually around here for the lateral hugging approach for the total hip replacement, or a posterior approach on the posterior aspect. So on the lateral aspect, there's a maintenance of the lumbar lordosis and the thoracic kyphosis, and the cervical is normal. The appearance of no scars on this side, and there's no wasting of the quadriceps muscles. I can turn behind. Patient does not appear to have wasting of the gluteus and also the hamstrings on each side. So now from walking and gait analysis, now we will look at after inspection. So we would like to let him sit down and see whether there's presence of scoliosis of the spine. Okay, so the general physical examination and lying position would include look, feel, move, special test. Look, we will demonstrate that there is no scars, no swelling, no erythematous skin, and also no visible scars on the lateral aspect of the thigh and posteriorly, where you see a surgical site for possible total hip replacement. And we also demonstrate that there is no wasting of the quadriceps and the hamstrings of this patient. Second part. After this, we will do the feel method, where there's 3 points of tenderness that would need to be illustrated, which is the lateral aspect of the hip, which is this. Anteriorly, we will be looking for a tenderness over the mid of the hip or mid-inguinal ligament, and posteriorly, you will see whether there is tenderness over the posterior aspect of the hip, and the anterior superior iliac spine, which is here. So at move, we would like to illustrate a flexion first of the hip, which is usually 0 to 130 degrees. At 90 degrees, you have to do the external rotation, which is usually 30 degrees, and internal rotation, which is usually 50 degrees. Now to demonstrate extension of the hip, we ask the patient to go sideways and to keep the hip and the knee relatively straight, and to see the extension, which is 10 to 20 degrees. Okay, come back. So now we will illustrate the special test for the patient that will include the apparent and true length of the patient. Also, we will demonstrate the four clinical special tests for the hip. Now for the special test, we will start with the Galeazzi sign, where we flex the hip to 90 degrees, or the knee to 90 degrees, and we examine where we approach the to see the length, whether there's any obvious shortening over the tibia or the femur. We usually use a board to demonstrate whether there's a shortening of either side, femur or tibia. That is the first special test. The second test would be to do limb length discrepancy. So the first one is apparent limb length, where we come to the base of the bed. We approximate both the malleoli and we illustrate whether there is any discrepancy within the length. Also, we can use a measuring tape and take a position where it's a central, either from the xiphiphrenum or the umbilicus, and demonstrate between the malleoli whether there's discrepancy. Now, another key method how to demonstrate true length would be first to stabilize the hip, to make the hip position or the position of the crest, iliac crest, to be the same as the edge of the bed. So I would demonstrate by putting the patient in truly square position, and I would take position of the anterior superior iliac spine and measure to the medial malleolus, and to demonstrate true length, where this patient obviously does not have any shortening. Lastly, I would like to bring you guys to how to measure the shortening, when there is a shortening over the femur, and how to demonstrate the Bryan's triangle. So for the Bryan's triangle, there's three structures, anatomical structures. There are anatomical surface marking of interest. There would be the first one would be the general greater trochanter, which can be easily palpated on the most lateral or most highest proximal aspect of the femur, lateral aspect of femur. Now we like to see the most highest point where the anterior superior iliac spine is, which is here. And all we have to do is now to connect both of them to make the Bryan's triangle. Now I need you guys to compare this distance to the opposite side to rule out a pathology or a hip shortening of the affected hip joint. For the range of motion, we would like to demonstrate the AB and adduction of the patient. So we would like to demonstrate the AB and adduction of the left lower limb. So I usually encourage my doctors to remove or flex the knee on the opposite side, hold the hip, and abduct. It's usually 0 to 60 degrees of abduction and 0 to 30 adduction.